Hi, I'm Dr. Nanavati. Thanks for joining me today. Today I'm going to talk to you about white coat hypertension. White coat hypertension is defined as a blood pressure greater than 140 over 90 measured in the office with normal blood pressures measured at home. So, what is the prevalence of white coat hypertension? Well, it actually occurs two-thirds of the time. So, two-thirds of patients that come into a doctor's office have a diagnosis of white coat hypertension. So, is there any prognostic significance of white coat hypertension? Yes, there is actually. 5% of patients who have a diagnosis of white coat hypertension end up getting a diagnosis of hypertension with end organ manifestations later down the line. Also, people with white coat hypertension have a higher morbidity and mortality compared to those with normal blood pressures. But at the same time, those with white coat hypertension have a much lower morbidity and mortality compared to patients with an actual diagnosis of hypertension with end organ manifestations. So, what are the things that could lead to white coat hypertension? Well, those factors that cause white coat hypertension or elevated blood pressure are multifactorial. The biggest, the most important one or the most common one is anxiety. Because when a patient comes to the office, they are not expecting good news. So there's already this baseline anxiety because they have a foreboding that they're going to have bad news given to them. They also have a anxiety secondary to the fact that they may be discovered that they're non-compliant with their medications or they're non-compliant with their treatment plan. There's also a baseline flustered frustration that can happen when patients come into the office because they're often running late, or they might have run into a traffic jam that may have gotten them flustered and resulting in baseline anxiety. Finally, there's also measurement issues by the staff. So when the patient comes into the doctor's office, within about 10 minutes, their blood pressure is measured. They haven't had a chance to sit down and relax. They haven't had any quiet time to compose themselves before getting the blood pressure. As I told you on previous videos, you need at least 5 minutes of quiet time, undistracted by social media or phone or conversation before getting a blood pressure. And that just doesn't happen in a doctor's office. So these are factors that come into play. Finally, caffeine. People who drink caffeine can have elevated blood pressure. That's just a known fact. So many patients that come into the office have already had some caffeine, so that may elevate their blood pressures. So these are things that can lead to elevated blood pressures in the office. So how do we diagnose white coat hypertension? Well, you have to first, just getting an elevated blood pressure in the office is not sufficient. You also have to get a blood pressure at home. And therein lies the problem, because home blood pressure devices are notoriously inaccurate. In fact, in a 2016 study, it was found that most blood pressure devices bought at drugstores are inaccurate by as much as 20 millimeters of mercury off. So they could be inaccurate. Now, what are my recommendations for this? So when you get a blood pressure monitor and you purchase it at a drugstore, please bring it to your doctor's office. Make sure that you get your blood pressure measured with a normally calibrated device in the doctor's office. Then you use your blood pressure monitor and see the difference. If there's minimal difference within 5 to 10 millimeters of mercury, then you're fine. Go ahead and use your device. If it's greater than 10 millimeters of mercury off, please return this device and get a new one. So these are my tips for measuring blood pressures and getting a blood pressure device at home. And if you have any questions, then you should certainly talk to your physician. And finally, I just want to let you know that having a white coat hypertension diagnosis is not a terminal diagnosis by any means. It is just a way to monitor you and to make sure that your blood pressure indeed is elevated. If it's not elevated at home, then there's no nothing to worry about, basically. So please enjoy this video, and if you have any questions, please reach out to my website at heartcareforlife.com. Thank you so much.